when we had to suddenly shut down our clinics. And so we had barely 24 hours notice. Moises had nowhere to go. He couldn't get his medication. He really didn't have other options. So that's the impact. We were able to come back online with our clinics after a few weeks for a 3-month period of time. We self-funded because we just could not shut the door in our patient's face. So Moises was first online at the door, but now we worry about him and whether he's been able to be part of the Colombian health system or whether he's relying on hospital care.
Hi, Christine Squires. It is such a pleasure to finally have the opportunity to speak to you. Thank you for your time today.
Oh, thank you, Jessica. Thank you for having me.
For those of you who don't know, Christine is the president and CEO of Americares, which is a health and disaster relief organization that is truly, truly remarkable. And they provide access to care both in the US and around the world. And Christine, I wanted to have you on to have you give us a picture first of the impact of these DOGE cuts broadly across the world, and then talk specifically about Americare's work. And I reflect on the fact that, the DOGE's evisceration of USAID were headlines everywhere, and now we barely hear about it. I've read that you said when funding for life-saving programs is cut off, the impact is immediate and devastating, and the consequences will be measured in lives lost. Since you're on the ground around the world every day, what have the consequences been so far?
Yeah. Okay. Well, Jessica, I want to say thank you for having me on, and I appreciate that you're bringing this back to light because it's been a while. So, especially this time of year and giving season, so people know what's happening here. So, to back up a little bit, U.S. foreign assistance makes up about 1% of the federal budget. So, and it's very impactful. It saves millions of lives around the globe every single year. So, when we see reductions in foreign aid, and part of that being global health is what we're here to talk about, the consequences are enormous. So investments in global health support life-saving medicines, vaccines, prenatal care for mothers, programs that prevent disease, and a lot more. So when those funds are cut, it means clinics close, it means children don't get the vaccinations that they need. A woman who is pregnant may not have a trained health worker by her side so she can deliver her baby safely. So these are just a few examples. We've seen millions of people whose lives depend on this support impacted. We've seen organizations like Americares and hundreds of others having to make very difficult choices about which programs are going to scale down. And we see ourselves looking for alternative funding sources so we can scale back up. So the impact is swift. It is large, and we're seeing that. We're about 10 months in since the cuts back in January.
Can you ground this for us a little bit? For individual patients, what does it look like when their medication and basic care goes away?
Yeah, absolutely. So again, we talk about big numbers, but I'm glad you're talking about bringing it down to individual patients. So I could share a specific example about Colombia. So Colombia is where we have been operating clinics for 7 years with funding from the State Department, US State Department, and we did have to shut those down because of funding cuts. And we have been serving 15,000 patients a year. So one of those patients, his name is Moises, and Moises was born in Venezuela with cerebral palsy. I should have backed up and said, so in Colombia, our clinics were providing care for Venezuelan refugees and migrants because there's been in the past 11 years, 8 million people who have fled Venezuela and many to Colombia, which they find as a safe haven. So we have operating these clinics. When Moises and his mom were able to get to Colombia, they found an Americares free clinic, and he was able to get the support he needed for his condition and the medication that he needed. He'd been coming for years when we had to suddenly shut down our clinics. And so we had barely 24 hours notice. Moises had nowhere to go. He couldn't get his medication. He really didn't have other options. So that's the impact. We were able to come back online with our clinics after a few weeks for a 3-month period of time. We self-funded because we just could not shut the door in our patient's face. So Moises was first online at the door, but now we worry about him and whether he's been able to be part of the Colombian health system or whether he's relying on hospital care.
It's a fascinating story. I want you to tell us a story of an instance where you were able to keep your doors open, but I heard you speak about this, and I think it's in El Salvador. Would you tell us, give us real time, your clinic does what, it's serving
Mhm.
whom, and then you get this notice from DOGE or from the US government. What
Sure.
happens?
Yeah. Yes. So for El Salvador specifically, we have been, and we're still running the clinic. We've been running a clinic there for 21 years. Actually, what started with the help of USAID and then other funding sources. And that's a family clinic. So that is in a rural area of El Salvador. And that means that your family can come for the day and get a whole suite of services. You can see a doctor, you can get labs, you can get a mammogram. It's really, really incredible. It's high quality service. So there are, we see about 25,000 visits a year. And since its inception, we've seen over 1 million patients. So it really is incredible. And it's in a rural area. So it's the only option for a lot of families. So what we were hoping to do is expand our health services. We do care for families and mothers and babies and build on in addition to service more moms and kids. And that was a funding of $600,000 that was canceled. And so now we're looking for other ways to expand those services. But receiving that notification, especially with Colombia, when you really had to shut down quickly, it was shocking. We knew in our sector that there were going to be in the next budget cycle some cuts. So we were expecting that, but we didn't expect what happened so abruptly. So it was shocking and also devastating, of course, to organizations, but mostly to people who depend on these services.
And you were basically, maybe it was Colombia that I'm mistaking it for. You were
Sure.
told basically you have until 5 p.m. tonight or tomorrow to shut your doors.
That's right. So in Colombia, we got the notice at 3:20 p.m. on a Friday, and by 5 o'clock, we had to shut our doors. So what I had to do was first we have 80 local staff in Colombia. So, let the director know and the team know, what happened, and we've got to take a pause. We thought it was temporary at that time. And then we do have Saturday hours. So one story, one of our staff members told me that there was a mom who was having some complications with her pregnancy and she was coming in for an ultrasound the next day. And where was she going to go? So just absolutely devastating.
And you literally, you had patients in the clinic, you had patients signed up for tomorrow, and you had to just shutter the place.
We did.
In hours. It's
We
crazy. I know you, and you said this, but I just want to underscore you were able to,
Sure.
I guess, raise the private funds to reopen 3 months later.
We opened for 3 months. We shut down for about 3 weeks because we had to sort of, take the branding down that was associated with and all of that and just get everything ready. And then we were able to open back up 3 weeks later for a period of 3 months.
I see.
One of the programs we were running along with our clinics was a program to help transition whoever we could to the Colombian health system.
I see.
So we want to transition patients and also try to provide other resources where we could.
So can you help folks understand why is it valuable for the U.S. and donors here to fund healthcare to, frankly, people in other countries if they already have their own health system and if they already have a country that's supposed to be providing for them?
Yeah, absolutely. It's valuable because we are a globally connected community. We're a world where if communities are stronger, then it does, impact us everywhere. And so then for the Colombian health system, where you're keeping people healthy, people thrive, economies thrive. So it really does make a difference. It's good for the U.S. and the U.S. is the largest donor in the entire world. We're the most generous country in the world, and we have that reputation. So it strengthens our brand. It keeps us, it keeps economies strong. So it also is just basic humanity. You want the best for people, but it does strengthen us as a global community.
Do you know, are we still the biggest donors in the world?
We still are. Where there is, we don't know what's going to happen with the next budget cycle, but after some time, about 50% of the funding did come back online, but we still are the largest country donor in the world.
Let's hop back over to El Salvador. I understand
Sure.
you run something there called the Poverty Access Program. Can you walk us through what that looks like for a patient who shows up at the clinic? How does the program change? What care are they able to get?
Sure. So at our clinic, what we do is, again, we provide full service for the family, and the Poverty Access Fund, we do require a small fee, but this fund allows families to be able to get their care for free. So they can access a fund that gets them the care. And it's really, again, they get the full suite of services, so they don't have to rely on hospital care. They can get, again, labs for their children. They can get dental care. They can get mammograms. And it's a full day event. A lot of families travel from far away. So we also have a facility where they could have lunch. And we say patients, but our team in El Salvador, these are not just patients. These are, like family to them, because we've had patients who've been coming there for 20 years. When I was there last April, there was a health coaching session happening, and I was observing. So I asked one of the patients, I said, "Can you give me some feedback? Tell me what your experience is at the clinic." So she stood up and she said, well, first of all, she'd been coming ever since we opened our doors. Her whole family, which is now expanded, has been coming to the clinic. And she said, "I feel like I'm treated like a queen." So
Aw.
that's I remember that moment. And so that's just the kind of quality, compassionate care we're providing.
I'm just curious because I'm hearing you describe this and thinking, gosh, we could use that in parts of America. Do you provide this kind of service here domestically?
We do have 4 free clinics that we own and operate in Connecticut. So we do have Americares free clinics in Connecticut, and we do support, there are free and charitable clinics across the US. So we support 900 of those clinics by providing free medicines and medical supplies, which is really impactful because you may know that free clinics have very, very small budgets and a lot of patients to see. So that really helps them relieve their resources so they can maybe hire another clinician to come in and help some patients.
Let's step back for a moment and just help people understand, what is Americare's history? Who are you? Where did you all come from? It's been around a while.
We've been around for 46 years. Tell you how we were founded. So our founder, his name was Bob McCauley, and he's a businessman. He lived in New Canaan, Connecticut, and Bob was always reading the news, always watching the news. He was very globally minded, really wanted to see what was happening across the world. And obviously, the reading the news, there's a lot of tragedy that happened, and he just could not stand by and watch that happen. And so this started back in the 70s, that he saw something happening across the globe in Vietnam, and he took a second mortgage on his house to help. So that's how dedicated he was. So some years later, he started Americares, and his saying was, "Make it happen." He used to leave little Post-it notes on people's desks that I'm told is MIH, right? So let's just make it happen. We expanded that to make health happen. So that spirit, we do emergency response. We're nimble, we're quick, we're prepared. Of Bob just lives through the organization. So a little bit of our history and how that manifests now is, and we provide free medicines, medical supplies, health programming. We respond to about 35 emergencies every year on average and reach 80 countries with health programming. But we're not a large staff size organization. And one of the things that really drew me to Americares is how we work in partnership. So we have thousands of health center partners around the world. We have private sector partners. We get our medicines and medical supplies donated to us. So it's that leverage and that impact that we're able to expand that I feel really differentiates Americares, and why I do feel that we can fill those gaps that are left by the cuts in funding, and then we can reach further.
I mean, it's remarkable. Do you deliver $1 billion in aid each year?
We do yes, we
Crazy.
do. We do.
It's amazing.
That's the value of the medicines, medical supplies, and then also the health programming.
It's remarkable.
Mhm.
You, in addition to Americares, I think you serve as board vice chair of something called Interaction. So you have exposure to other NGOs. Can you give us just a sense of, what kind of ripple effects has DOGE's cuts have across the NGO community globally? And do people just, sort of resent America now around the world?
I'll start with the first. So yes, so Interaction, I'm the vice chair of the board, and we're a group of about 160 nonprofit organizations that are US based but work internationally. Interaction itself has been around for 40 years. And so it's a way for organizations to convene, to partner with one another. So We have working groups maybe on specific programs of like what's happening in Gaza, and also interaction. Part of their role is to work across the aisle. They have relationships across the aisle to ensure that foreign aid funding is moving forward, and then focus on humanitarian assistance. That's what interaction does. What I find so valuable about it is that this is a time for partnership. And so, I think I'd mentioned earlier, I was at a conference, or maybe I didn't, a week before, that the budget cuts had come out, and we were expecting something, and we're already planning on, okay, how are we going to come together to fill in those gaps, or how are we going to advocate for maybe less reductions in foreign aid. So that's what interaction is doing. And one of the positive signs we're seeing, but we don't know because we'll see what happens, is that we initially heard there was going to be a 50% cut in foreign aid next year, but it's only looking like a 20% cut. I mean,
You mean in the U.S.?
In the U.S., sorry, yes.
From our
US.
already reduced level.
From the original level, from what I understand. But we will see. So
it could bump back up.
It could maybe bump back up, but there is energy
USAID? Or what would it flow through?
No, it's all in the State Department right now.
It.
So USAID is
gone,
as you know, severely downsized, and there's a few hundred people left that work there. So there are positive signs, but it's early days still.
Right. Don't get ahead of ourselves.
Yes.
And what does the international community of NGOs, how have they reacted to all this?
We are the first shock, and what are we going to do? A lot of NGOs had to downsize their staff and scale down their programming. And we were just at an interaction conference, and we're talking about how do we look forward. And so it's going to require focus, streamlining, and partnership, and seeking other funding sources where programs that NGOs who are very heavily dependent on foreign aid cannot pick back up.
Got it. Would you give us a sense? I know we touched on this, but when funding is cut to people who are relying on it for healthcare, especially in Latin America, how does that impact the U.S. both for its public health, for immigration, and even economically? Like, does that have a ripple effect that's felt here at home?
That's something I think we're going to have to see. It's early days. I would say maybe in the, as we're thinking about Colombia, I think having an option for Venezuelans who are seeking refuge in Colombia, and having a strong health system there, I think would be helpful. But I think, it remains to be seen what the impact is. It's still, I know it was 10 months ago, but still a little bit early.
Okay. Have people died already around the globe as a result of these cuts?
What I read, and a Boston University researcher published that it's estimated about 600,000 people have died as a result of USAID cuts.
Yeah. Can you give us just a sampling of what, not even all the countries, because you said you're in more than 80 countries, but what regions of the world do you guys operate in?
Sure. We operate in all regions across the world. So we're in the US, we're in Latin America, we are Asia, a few countries in Africa, and also we're operating in Ukraine and Gaza. So we are everywhere. And what we're focusing on under-resourced communities, and also humanitarian crises and disaster settings.
Go ahead.
Yes. No, I was going to say,
go ahead.
That I do know that the USAID had been reaching about 130 countries with their support.
And do you stand up the infrastructure that allows doctors to do their work, or do you bring the doctors?
We mostly stand up the infrastructure. So it's the examples of the clinics that we own and operate are just the only ones that we do that I mentioned. And really what our model is that we want to support the health systems that exist. So again, we'll provide those medicines that are needed. We'll provide training, we'll provide other support. So we really want to stand up what's there. And part of our model is working locally. So we want to understand from our local partners what the needs are. We listen, we develop solutions together, but we don't swoop in and swoop out. So it's really supporting, and our model is we want the health system to be sustainable. We want clinics to be able to continue to operate and to reach deeper into the communities that they serve.
I mean, that's what's so cool about your organization is it's barely public. The average person doesn't know, and you're behind the scenes making it possible for people who want to do the work cost effectively, efficiently, and for the long run. It's truly, I'm very impressed.
Well, thank you.
Can you give me a sense?
And you're having us on here, more people will know who Americares is. So I appreciate that. You're doing your part.
There is a lot of confusion about foreign aid. I'm going to give you an opportunity to say, what is the biggest misconception you wished you could correct?
Okay. One is I don't think that most people know it's less than 1% in the US of the budget. So that's one, but maybe I'll give a second one since I already said that. I think there was a narrative that foreign aid was wasteful and not impactful, and the actual opposite is true. So you take that 1% stat and you think about millions of lives saved upon millions of lives impacted. That is a really impactful investment. And when you are an organization receiving money from the US government, you have to be set up very internally to make sure that you can operate, you run impactful programming, and you provide the impact reporting on a regular basis. So there are statistics that show how impactful this funding is, and to, again, strengthen communities, save lives across the board.
I'm going to give you an opportunity to tell us, what does the next year look like for Americares? What can people do to support? And I also want to ask, for people who feel powerless, what keeps you going?
Yeah, absolutely. Great question. So there's a lot that keeps me going. One is that I do feel that there is a lot of energy and support from our donors out there. We've been having conversations, we've been getting people together, and there's energy to want to do something. And so I feel like there is the broader community of people who really care and want to make a difference. What also keeps me going are the people that I meet when I travel. So like the stories I told you, like Moises, people who are, we talk about people receiving aid, but these are people who really have agency in their own health and then also become community leaders. So those people keep me going because I know they're going to make it possible for us to continue to make an impact. So I find hopeful is we are not only US government, but Americans are the most generous country in the world. It's a proud American tradition. And I know that our donors and potential supporters are very, very proud of that. So that keeps me going. And what people can do to help is, again, it's giving season. So please, if you support a charity, think if you can support a little bit more or tell your friends about it. For Americares, learn more about us. You can go to our website, americares.org, and click on whatever you're most interested about what we do. But that would be very impactful, especially this time of year. And I know that we will coordinate, we will be able to fill some of those gaps.
That's great. Last question. What happened to Moises? Did he get health care inside the system?
Not yet. I think Moises is relying on hospital care. So we're hoping that'll be possible for him.
So difficult. But these are the realities that we should be aware of, because these stories come and go from the news, and we lose focus, but they stay in people's lives. The impact is lasting. And I'm so grateful to you for the work you're doing to make a difference for those people where you can. You can't do it everywhere, but you're doing so much.
Thank you so much, Jessica. And again, thank you for this conversation, for bringing these things back to light.
Of course. Christine Squires with Americares. If y'all aren't familiar with it, please go check it out. It also has a remarkable history and story, and they do exceptional work. Christine, I hope you have a lovely holiday. You get a break from all the hard stuff. And
thank you. You too.
And thanks for the work you're doing.
Thank you. Thank you, Jessica.